The new variant it spreads faster, but it is less it's less dangerous, and thirdly, the infectious rate now is down from 5 days to between 1 and 3 days. So the Ministry of Health has recommended to Cabinet yesterday to remove all the restrictions that we've had.
While the new Omicron subvariant comes with all the symptoms that other COVID variants inflict, it is not considered to be as deadly a virus as the Alpha and Delta strains. But what is unsettling about the Omicron BA.5 sublineage is that it has shown to be vaccine resistant, so we're more prone to endure the symptoms.
It's able to hide from the antibodies that you got through the natural infection and vaccines. So it's transmissible same way, but it could hide out better against the killers that your immune system develop against the virus. So that is why people can become infected again with this BA.5 in a shorter amount of time. For example, you could have had COVID 1 month ago and you could catch COVID again with this new variant. Thankfully, again, this variant, like the other Omicrons, are also not as deadly, meaning that they kill a whole lot of people or make them end up in the ICU and intubated and so.
While Prime Minister John Briceño says the government will not reintroduce any restrictions, they are advising everyone to stay safe nonetheless.
We have not made any recommendations to put back a mask mandate, but we are encouraging persons, especially in crowded indoor spaces, to take on the responsibility and wear your mask, because it's in crowded places that you tend to get infected. If somebody sneezes, if somebody starts to cough and they don't have on their mask, you need to make sure that you have on your mask.
The Ministry of Health is going to continue with the very aggressive campaign, the mask wearing when necessary, physical distancing, washing your hands, and also testing when necessary.
Internist Dr. Fernando Cuellar, a private medical practitioner, differs with the government.
I would have been the first to say, let us put mask mandatory again. Thing done. I mean, nobody will lose face, nobody will shame face. Nothing is wrong for you to say, let us step back again and we have put mask mandatory, okay? And continue to push the vaccine. They look at us in the medical field as being overcautious perhaps, or too jumpy, or too afraid, and I think, but let us use at least the mask. And yes, we're not close the borders or we're not restrict visitors. That not necessary at this point.
While the Omicron BA.5 variant tends to resist the antibodies it encounters in the body, there are fewer hospitalizations and deaths because it does not cause severe respiratory difficulties as previous variants. In the event there are other vaccines recommended for these subvariants as the COVID virus continues to mutate, Dr. Melissa Musa, who is now the Ministry of Health's Director of Public Health and Wellness, assured the media today that the government is already looking into working with groups with other nations to be able to access those vaccines if necessary. Reporting for News 5, I'm Marion Ali.